Welcome back, Doc.
Hi, how are you?
I'm doing fantastic. How are you?
I'm doing great.
So, we have a special guest today, and doctor is a
Family medicine.
family medicine doctor. And what brought you here?
For years and years, like as far as I can remember, my inner thigh pain was a major reason coming in here. I was suffering for the last 20 years.
Inner thigh pain, 5 years, 10 years, 15 years?
20 years, plus 20 plus years.
Okay.
I've done like a lot of things as a physician, like gone to like orthopedics and talk about it, anti-inflammatory and things like that.
So what did they find? What were some of the things that were found here? I mean, you've been to different specialists, different doctors, yeah?
Just like old groin injury, just relax, exercise, stretch.
How long does a growing injury last, though?
In this case, for more than
20
years.
Okay.
Yeah, that was the major issue that brought me. Actually, my wife found you online, and she really impressed by your work. And I think that I did not know about it that you do nose jobs too, and I have a problem with my nose, and I put off my surgery for years. In residency they told me that you need to fix it, but I said I don't have time.
Okay.
And then she said you do a nose job too, so that's another reason that I came in. So those are the two biggest things, and back pain issue. But after first visit, man, that pain is almost like we've been like 4 weeks now. Almost 4 weeks ago.
Now, when we say 4 weeks, hold on.
I saw you 4 weeks ago. The first visit, I have no pain
But
for 4 weeks.
but I'm not seeing you like 2-3 times a week for 4 weeks.
No,
That's
no,
not what happened.
No, it's just first visit, it was gone.
Yeah. So we saw him first visit, and then he came midweek, and of course he's got a busy practice, and he's got a lot of people to help. So he only comes in on Saturday. And so he's saying those 3-4 weeks, you're coming on the weekends.
Yeah.
You're not coming during the
3-4
week.
visits.
Because some people will think, oh, he has to, he's coming 3 times a week for 4 weeks.
No, it's only like 3-4 visits. And the pain gone after the first visit.
In the growing.
Oh, yeah.
And what are we feeling now?
Feeling much better. Like I feel I can sleep better, I can have refreshed sleep, and I don't have to take pain meds. And my posture is getting better, and I'm overall, like you can ask my wife too. I'm a much happier person with the pain gone.
Very nice.
Yeah.
Well, I appreciate you sharing the story today.
Yeah. And thank you for helping me. This pain, man, this is
Absolutely.
It was a bad pain. I think one night I was like really bad, and I think that's what prompted her to email you, and that's where.
Good job, wifey. You did a good job.
Yeah. Thanks for both of you.
All right, so we're going to continue today.
Oh, yeah.
And let's see what we find. So what are we feeling today?
Not much, just a little tension that I just felt this morning, but no pain, and then just a little bit back pain here, a little bit here, but not much. Okay. After your last one, I cannot slouch anymore.
And we talked about that, right?
Yeah.
That it'll hurt to start slouching.
Yeah, and that's a good thing, actually. It gives you posture.
Cool. Let's go ahead and get started.
Yeah.
Jello. All right, so we've been working on, we started on the sacrum, S2, T4, C7. Sacrum, moved to T6, C1. Our last visit was T2 and L4. That was our last visit, starting at the base of the neck. So the last visit was T2 and L4. Let's see what we got today. Little flutter, but no break up top. Six points, T2, left side. Awesome. How's practice doing for you in these times?
Good. We're trying our best to help people.
Yeah. 5 points, L4 today, 4 points. Very nice. So we're still at T2 and L4, just a tiny little bit. He's doing very well. Good. Scoot forward a little bit, please. Let's check the movement in your pelvis. Feet together, open and close the knees, open and close. Good. Right side only. When he does the right, left is good. More movement of the skin. The joint is fine. Left side only. Same thing. More movement in the tissues. You don't feel restriction when you're opening, do you?
No,
No.
it's a little tension.
Little tight on that growing moment. Okay. Sit back for me, please. Head down. Let's go ahead and statically palpate. 1, 2, 3. We're still at 2, okay, sir? T2. T2, and as soon as we get to right about L4, right there. So today we're going to do T2, we're going to do L4, and we're going to tune up the rest.
Yep.
Okay, let's do it. Sit back for me, please. T2, we're going to set it as a... Actually, T2 is a PLS side slip. We're going to need to do it over here. Let's go over here face down, please. I'm going to have to do it without help today. Slide up a tiny bit. Good. Relax but not yet. Okay, so T2 is a PLS, but it's also a side slip, which means it's laterally shifted to the left. So as I explained in a previous video, it's a very different adjustment. It is a little spicy, but you like your spice, don't you? 1, 2, PLS. I'm actually on the transverse on the right side with an opposite torque. That's part 1. Okay. You good, sir? Okay. That's the rest. Home run. 5. Want to help? Cool. L4. You're good. Hi.
Hi.
How's it going?
Good.
He was behaving today?
Yes.
Sure? Aramse. Home run. Thank you. I got you, sir. Dr. Saab. Dr. Saab. एक minute.
Okay.
Come off slowly and let's walk a straight line back and forth.
Yeah, it feels
Good?
good. Yeah.
Have a seat, please. Sit up straight. Good. Awesome. Taking a nice deep breath. Very good. What's the plan today, guys?
Oh, my brother-in-law birthday today.
Oh, nice. That means cake. That means mitais. That means nashtash. That means kebabs.
Oh, yeah, it will be something like that.
T2 is clear. Good. L4 is clear. Awesome. Let's continue, sir. Ears. Shoulders. Nice. Shoulders. There you go. Let's go on your back so I can work on your feet, please. Let me put paper there. There you go. Very nice. So, wife asked you to come. You gave it a shot. You've been open towards this type of work in the past?
Chiropractor, yeah?
Yeah. So why is there so many misconceptions or a lot of, I'm curious and just straight up, why do the doctors actually don't like the chiros? You know, not that there's a lot of ones that are getting it now. You're one of them. They're getting it and it's working together. It's not about, it's everyone has their job. And this is a big misconception. I want to just share this before I ask the question again. And we talk about this in class, in school. We talked more about this in our seminars. Why do we have chiropractors on the planet? And it's a trick question.
I personally never had a misconception about it. I think the problem that arises in medical school the amount of time that they spend on the, like, you know, physical adjustment kind of, aspect is very little.
Right.
And then some people, like if they go into orthopedic, their primary focus becomes like fractures or things like that.
Correct.
So movement issues or balance issues are not like as emphasized. And if they're not, then in back of your mind, you don't think about it in that sense.
Right.
Like the balance issues or hip balance issues or back issues. You just, I think, primarily focus on pathology or trying to find the pathology.
Correct.
And that, I think, is kind of like lacking in medical school, attitudes towards this musculoskeletal system in general. So, lack of, training, or I would say, or lack of understanding.
Is there an understanding of the neuromuscular skeletal system and the relationship?
As far as the pathology or anatomy is concerned, yes,
Yeah.
you have to.
Yeah.
But as far as
Movement,
the
kinesio.
movement, and then also the chiropractor, input on that part is, I think, is kind of not there. People, like in medicine, it seems like when we find a pathology, we feel good about it, and we try to figure it out, but sometimes we cannot grasp that.
There has to be a thing, though.
Yeah.
And sometimes there's not the thing that has manifested.
Yeah.
Right? Come up slowly, please.
And also, when you train in a certain way, you start thinking in a certain way, and thinking out of the box is difficult.
In any profession.
Yeah.
In any profession. And I want to thank you for sharing today. It was good, and it's been really cool working with you.
Oh, nice. I'm grateful that it really helped me.
Good.
My wife can attest to that. It really, really helped my pain. Yeah.
Okay, shall we continue? Got to do the hands now. Stand up, please. Oh, wait, I forgot the nose. We need a nose job. Let's go on your back. Bulgia. That's not good. Oh, on your back.
Yeah, that helped me read that.
Okay, raise your head for a second, please. 1 second. 1 second. There you go. And
You did the job thing too, that helped.
yeah, so let's do both today, okay? Straighten up. Chin down. So this is the bone. This is the septum. This is the left side. It's right there. So it's misleading because the bone goes to the side, but I'm not adjusting a bone as such. We're working on the septum. Madam, please uncross your arms. Uncross, please. Thank you. So we're doing the right septum. Breathe slowly through your mouth. Take the nose all the way over. Gotcha. Bus. Take a nice deep breath in through the nose. Come up slowly. Yeah. And now let's do the jaw. You know I call that my $5,000 nose job, right?
Yeah.
Look up, please. Slowly. Can I bring this down a little? Slowly open. Open. Slowly close. Slowly open. Okay. Hold, please. Let me just go to the X-ray. Okay. So we need to do left, right EX, left AI. Open all the way, close halfway. Good. Let's use the condyle block. Open. 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 Slowly close. Ah! No! Tough guy. If anything is too much, just tell me. I'll slow down, okay?
No, it's not.
Open wide. Close. Open. Close. Open all the way. Close halfway. Close half. There. Open all the way. Open, open, open. Open. Close. Ah, gotcha. Dr. Seb, done. Sorry, Dr. Seb, but I had to do it.
Yeah.
Thank you. Let me hold on. Hold on. Now you get a buff and polish. Gotta make sure he enjoys that lunch today. 5, 4, 3, 2, 1. Sit up straight, please. Five, 4, 3, 2, 1. Awesome. Stand up, sir. Let's finish up with the hands. Squeeze. Squeeze. Straighten out the elbow. Posterior lunate. Posterior lateral scaphoid. Squeeze. Posterior lunate. Posterior ulna. Bas. Thumb.
Nice.
Squeeze. Squeeze. Still something here. Squeeze. Ulna. Relax there. Relax. There. Squeeze. Good. Squeeze. We're all set for today, sir.
Thank you very much.
Thank you very much.
I'm really grateful. Thank you very much to
I-
you and my wife finding you and came in perfect.
I appreciate it.
Thank you.
Thank you, sir.